Come with me to a magical place where being labeled the pork queen is a compliment, where being nice is just a way of life, and where all leaders of the free world must pass through. Welcome to Iowa. Whether you're a current Iowan, an Iowa expat, or an Iowan at heart, this show is for you. This is the Iowa Podcast. Real Iowans, real talk, no drama. I'm Justin Brady, and today I'm joined by Dr. Jon Van Der Veer, founder of Exemplar Care. Dr. Jon, thank you so much for coming on the show. I really appreciate it.
Justin, thanks for having me.
The CDC's Advisory Committee on Immunization Practices voted unanimously to add the COVID vaccine to childhood vaccine schedules. But there's a lot of confusion around what that means. Is that a mandate? Is that not a mandate? Is this a good idea? Is this a bad idea? So that's what we're talking about today. We're just going to talk about the data. But before we do that, have you subscribed yet? Subscribing is free. It doesn't cost a thing. It won't charge your credit card. Also, have you rated this show 5 stars and given it a review? Believe it or not, when you do that, it increases the amount of people that see this podcast in their player. So make sure to listen to every episode, make sure to subscribe, it's free, and make sure to rate it 5 stars and tell your neighbor how cool the Iowa Podcast is. All right, Dr. Van Der Veer, to get the credentially stuff out there first, certified by the American Board of Internal Medicine, and before starting Exemplar Care, which you have founded, obviously, you served as the chief medical officer at both Greene County Medical Center in Jefferson and CareMore Health in Des Moines. So I just wanted to get that in there. So obviously, we want to talk about the CDC Advisory Committee. For those that don't know, the CDC Advisory Committee on Immunization Practices voted unanimously to add the COVID vax to childhood vaccine schedules. Is it a little shocking that the advisory committee voted unanimously, or is that pretty normal?
Typically, they are the group put together. Typically, is fairly lockstep. A lot of times, the data and the recommendations don't come in until they start to see that it's going to be a fairly wise decision. They're not going to take mediocre data or a substandard vaccine and spend a lot of time and effort fighting over nuanced details of the quality and the utility of it. So typically, by the time they get there, the consensus votes are not terribly surprising.
Got it. So by the time they advise, they're already pretty much in agreement. So obviously the news broke that they were adding it to, or they were recommending it be added to the childhood vaccine schedules. So when do you know when they officially accept, when the CDC officially accepts or rejects? Is there some kind of timeline on this, or is it when they get to it kind of a thing?
Every year they do an update for the subsequent year. I don't know the exact date of that, but it's usually they're prepping 1 year ahead. And they've also, in addition to adding this to the children's side, it's also added into the adult recommendation as well.
So those will go together.
Yes. So 2023's edited version looks as though their discussion was to propose and move forward with having the adult and children components added into the typical vaccine schedule.
Okay. So ideally that happens before the new year then, or is there other...
Yeah, when I was reviewing, and for any of your listeners who've never spent time on the CDC website, it's really quite the process to go through and find all of these components. But yes, they did have their meeting on the 19th and the 20th, of which they did make these recommendations on the revisions. It's not clear from their presentation whether or not they have fully approved and moved them forward. If they haven't, I have a hard time thinking they won't be doing so.
Okay, so you say you have a hard time believing that the CDC will not accept this recommendation. Why do you say that?
As far as vaccines go, and as you said, there's a lot of misinformation and a lot of political discourse over this topic.
Right.
Generally, the vaccines widely are deemed to be very safe. There are issues of pericarditis and myocarditis, which typically hit teenage males more than anyone else, and they actually recommend unless you have a health condition that puts you at markedly higher risk from complications of COVID, that if you have a side effect from a part of the vaccine, that you not continue the series. But in general, the vast majority of people do well and tolerate the vaccine without complications. And most importantly, as with any vaccine, the goal is there more benefit than harm? And there's this discussions of what the benefits of the vaccine are, but ultimately, especially in the adult world, that the likelihood of getting severely sick, hospitalized, and dying goes down, and that is the benefit of the vaccine, very similar to a flu shot.
Yeah, so I've seen the data, right? It seems to be, clearer that the older you get, the more heavily you should consider getting vaccinated, right? That seems to be, I'm hard pressed to find anybody that probably doesn't agree with that. But I think one of the debates out there right now is children who, what I'm reading, children are very low risk even without the vaccination. And so I think the question is, why add the vaccine to children if they're already low risk?
Well, so from the data that I've reviewed on this, there are still an unacceptably high number of deaths from this. It's markedly lower than, as you said, as you age forward, but it's certainly something that allows protection. And I always say, we can look at the data, you can split it a lot of different ways, but the benefit to watch for is who is the uptake, who are taking these things. And I think you're seeing widespread consensus not widespread, pretty widespread consensus in the medical community, and most physicians are vaccinating their children, which I think is not something to go unnoticed. I can tell you my wife is also a physician, and the two of us went and got vaccinated from our own perspective without batting an eye, almost reactionary. The first moment it was available, we got that. And we have an 8, 6, and 2-year-old. And frankly, our discussion changed quite a bit. And we had a much more heart-to-heart discussion about this before doing it for our children. But ultimately, after looking at everything, again, the harm is so low in this population that we ultimately moved forward and vaccinated all of our children.
So I know that's where the debate lies, right? And that's it's obviously a hard discussion and a hard choice for anybody, what medical things they should do to their children. So obviously that's, I'm not going to tell anybody else what to do. But I think I was reading that the cases of getting harm or death from pneumonia exceeded that of COVID-19. And so I think that's kind of the issue that a lot of people are looking at. It's pretty low. I guess I should ask you this, is this correct that it's pretty low risk? And what was it that drove you and your wife to make that decision to get your children vaccinated?
So looking at this across the spectrum, so we'll get to the children component, but COVID, just like influenza and any other respiratory virus, these discussions all come not in a vacuum, which is how we have these discussions as a society. But each one of these things is a tailored discussion that you should be having with either your pediatrician, family doctor, or general internist to kind of go through what your actual risks are. So it's kind of like in a pneumonia vaccine, the recommendation is 65 and above, and then the caveat, unless you smoke, which increases the likelihood of you getting pneumonia. So all of these things have different nuance that come along with them.
Right, of course. Yeah, that's fair.
And I think that's the most important thing is knowing your family and having someone you trust in primary care. A lot of times it's pediatricians or family practice provider for children, and getting their opinion on why you should or should not get this. Again, I think given the safety profile of the vaccines thus far, the risk of having some untoward outcome with your kid is worth preventing. I think one of the most important things to consider now as we move forward in the pandemic, as it's kind of aging out, and there was actually an interesting piece this morning on Omicron and its prevalence and persistence in the community, and it's kind of doing its own perpetual convergent evolution versus Alpha and Delta, the earlier ones. You're starting to see things that look like they've calmed down. Again, these were all developed in a markedly sicker version of COVID when it started. But this, just because things are heading in what looked to be a milder, more stable pattern, doesn't mean it stays there. But what we are seeing more and more of, and I think the last data I saw was roughly 7.5% of the population is struggling with some component of long COVID, whether it's fatigue. They're starting to kind of use the analogy to chronic fatigue syndrome, fatigue, mental fogginess, kind of just not hitting on all cylinders. You're seeing a lot of these things, and again, anything that's going to reduce that burden is still worth considering.
Now, so like 7% struggling from long COVID, from what I understand, unless this has changed, most of that's just self-reported, correct? People are just like, well, I'm struggling with fatigue. I don't know if there have been any actual clinical studies on that. Have there?
Correct, but that's what the estimated, that was, I don't remember what that source was. I can always follow up with you on that, but it's got a pretty significant impact. I can just say out of my practice, the number of people I see who are struggling with it. And again, these are, I can think of a guy who's a CEO of a company who is fully functioning and doing fantastic in life, who since, I think it was January or February, has really struggled to get back on track and be nearly as functional as he has been. And the only thing that's changed in that time period was having COVID. This is all, you take the complex components of life, but when the one thing that changes most drastically is that, it's tough to not credit that component. And this is kind of the same discussion we have with, well, people are in the hospital and they died from a heart attack, but COVID was present. So is it COVID or is it a heart attack?
right. Exactly.
You can't sort that out because the stress on your respiratory system from COVID may have been what tipped over your already bad coronary arteries to having a heart attack. I mean, these things are chicken and egg, and it's fun for everyone to fight about and discuss. But if you're the dead person or the dead person's family, it really doesn't matter which way it panned out. Yeah,
but I mean, I agree with you, right? Like there's so much cloudy data here, but and I think that's also an area of concern,
Absolutely.
though. Sorry?
No, I was saying absolutely.
Oh, yeah.
That it's a lot of cloudy, fuzzy data that really smart people are trying to work through. It's just not a linear process.
Right.
And much like all of COVID, this is kind of like we're still flying an airplane that's being built. It's really easy, and you can consider it a blessing or a curse as a physician. You learn about
but for that
flu. Oh, go ahead.
Well, I was going to say, for that reason, I think is why people are concerned that it's being added to the vaccine schedule, right? Like some of the older vaccines that have been around for quite a long time that we've had a lot of time to analyze, I don't think people are as worried about that. But when you're pushing something like this, not you, when the CDC is making these recommendations on a plane that's being built while it flies, I think a lot of people naturally assume, well, how can that not crash, right? And that's obviously it's an unfair metaphor, but going back to earlier, you mentioned cases of pneumonia or pneumonia vaccine being recommended for older adults. Because pneumonia took more lives of children than COVID did during the pandemic, do you think that the CDC will also be recommending the pneumonia vaccine be added to the schedule then to keep lockstep with these recommendations?
I am not going to answer that, not being a pediatrician.
Sure. Yeah, that's fair.
But another complex component is you can have viral pneumonia. So you can have pneumonia that's due to COVID and it's still called pneumonia and it's not called COVID. And so I'm not going to try to split the hairs on that data. And that's where I really think having that one-on-one discussion with someone you trust in the healthcare community is worth having.
Yeah.
And back to it being added to the schedule, I think, so it's on the schedule. Well, lots of things are on the schedule, and one, they had to go through being a new vaccine at some point, and they were put on and deemed beneficial. And 25 years ago, we didn't have the communication amongst the members of society that made these things as easy to be in opposition to. You went to your pediatrician, they said, here's what the recommendations are. Most people did them, but you always have the choice not to do that. And I think just because it's being added to the pediatric or adult schedules doesn't mean that it's something you have to do. I mean, influenza has been on the adult schedule vaccination for as long as I've practiced medicine. And every year I have conversations with people who choose not to get their flu shot.
Right, of course.
It's one of those things that, and I always say, as you get older, I always tell people 40, 50 years old, like, oh, you're not getting your flu shot. Okay, I recommend it, but I understand it. You'd probably be laid up for a week and not feel very good. And yes, it could get out of hand, but usually doesn't. And I just said it's something you're always going to want to consider as you continue to add comorbidities, whether it's heart disease, whether it's smoking, all those things. As you get older and the mortality data starts to be more relevant to you, that these are things you start to consider.
Yeah, and I'm glad you brought up the mandate thing. Like, this isn't a mandate. This is being added to the schedule. But you did, I want to parse a little bit of information. You mentioned that the flu shot was added to the schedule for adults. And I don't know the answer to this. This isn't a leading question at all. Is the flu shot added to the schedule for children?
Flu shots, they've all been on the schedule for years. None of this is new.
Yeah. For children, you're saying, too. Adults and children.
Yes.
Okay, got it.
Yes.
And so
kids have been getting annual flu shots recommended for, again, I don't know when these things all went on. I follow the guidelines. I don't usually study these all that closely because, again, prior to this, there's been minimal controversy about following these guidelines. And again, part of this is most people aren't alive while they're making these decisions, and we've obviously all been living through this real-time experiment.
Right. So when the CDC, it sounds like, in your opinion, obviously you don't know the future. You don't have insider information. I think that's clear to everybody listening. But
no.
It sounds like if you were a betting person, you'd probably put money on the fact that the CDC would add the COVID vaccine to the childhood schedule. But it is, this is the important thing, is that it is not a mandate. They don't have that authority. But who does have that authority? Like, does that come down to the states then? They can mandate, or is it just they can mandate only if it's in like a public school situation because they're going by the CDC recommendation? How does that work?
So I'm not sure who has that exact power. Obviously, there are meningitis requirements for continuing school, things of that nature. All of those mandates for public school all have exceptions and have opportunities for people to respectfully decline with the support of their care team, whoever they go see. And part of this is, it's interesting. There are some pediatricians who, and there are some clinics in town who will not even see your children if you're not following the recommended vaccination schedule. And there's a view to be taken from both the provider side and from the parent and child side. Everyone has to make their best decision, and what seems like as a parent might be the best decision for your child, your provider decides is not the best decision for your child, and those are things that are at odds, and that's just how this works. And you may disagree strongly with who you see, and you seek out somebody who agrees more with what you have. But hopefully, and I can vouch for all of my colleagues in primary care, everyone's trying to do the best thing for the person in front of them when they're there.
Yeah.
And whether or not you agree with what they deem to be the best thing is, that's a completely different discussion.
Yeah. Earlier you mentioned the stroke and myocarditis thing, right? And we all see clickbait about that.
Pericarditis and myocarditis.
Yes. And we've also, I should say, and we've also, you didn't say that, but we've been seeing reports about strokes increasing. But this is mostly, like I said, it's kind of all out there in the ether, and you see a tweet and people make an assumption. Are strokes actually on the rise? Is myocarditis actually on the rise? And if they are, is it just a causation correlation kind of thing people are falling into?
So I have not seen any data on strokes. I mean,
I haven't either. Again, not a leading question at all. I haven't either.
No, I used to be a nighttime hospitalist, and for adults, I would admit 1 to 3 strokes almost every night. It was uncommon, and this was a decade ago. So strokes are incredibly prevalent. They're obviously more prevalent in older populations. As for the myocarditis and pericarditis, there is data that above the baseline population, so what you would assume with no vaccine, what's going to show up, there was a bump in specifically that teenage male time period, but it was just barely above the baseline amount. Now, I've also seen people who were unvaccinated who've had COVID who've subsequently gotten myocarditis and pericarditis while they were infected. So you get a little bit from, is it a component of how the vaccine works or the process itself?
Yeah.
You see it in the novo disease as well.
Yeah, and so so what I'm hearing, and I want to be really fair, right? Because this is important information, and I think that just a data first conversation needs to happen, which is why I've invited you on this show. But so we do there may be a bump, there is a bump in myocarditis and pericarditis, if I'm saying that right. But there is just not enough data to analyze if it's the vaccine doing it, if it's COVID doing it, or if there's something else at play. Well,
so again, for the adolescent teenage boys, it is deemed to be related to the vaccine.
Oh, it is. That is okay. Yeah. I didn't know that. So those are linked to the vaccine at this point.
Correct, and that's where I was saying if that occurs on a first dose, the CDC recommends not continuing the series unless you have enough underlying conditions that make COVID infection more severe in and of itself. So that's what I was alluding to earlier. So that data is tied directly to the vaccine.
Wow. Okay. And so why and maybe you don't know the answer for this, but why just teenage boys? That seems oddly specific.
It does, but that's what the data shows.
Right.
So I don't know if it's related to, and I'm purely speculating, I don't know if it's related to sports activities, something that causes the heart to get inflamed. I don't know what that underlying mechanism is, but that's where the data initially showed up. And I think an interesting point for you and listeners is you have, whether it's Pfizer or Moderna, you have the trials going on initially, and these things were not seen initially in the trials, but you have the post-approval analysis of much bigger populations once you get it. So rare events become more obvious, which is true of every medication, everything that's ever been approved for consumer consumption. There's always things that show up after the initial trial periods.
Right.
And this is one of those things that popped up and were attributed to the vaccine as a side effect.
And so one of the things we've also been hearing, and you kind of alluded to this a little bit earlier, is that the data, I think, well, let me rephrase this. Last week, I think it was, there was a little bit of controversy because the data wasn't released that informed this panel's decision. And data has been a little slow in coming. Is that still the case, or are they releasing that data now? Do you know why they're not releasing that full data? And what data are they not releasing? Like, what's the actual controversy? I think that's another thing people don't understand.
So whether it's me being in my own little shell, I have not seen the controversy about that. I don't know whether that's coming out of the Twitter sphere or where it's coming from, but they usually are pretty open and transparent on these, and they show the safety and efficacy data typically as they move forward. Now, there are definitely times where we've been out in front of the data and you're making decisions. I mean, this goes back to the start of the pandemic. You're making decisions that aren't fully data driven, and the data either catches up and confirms or alters your next move. I mean, this is back to the flying the airplane you're building. And I think it's good to take the historical, I'm using air quotes now, view of what the initial version of COVID looked like. So I was working at Lutheran when the first case came in, and I admitted the first gal to Lutheran Hospital in the Metro. It was a Sunday evening. It was the end of a 14-day shift. I kind of just dove in and said, all right, I'm not going to have my wife work. I'm going to go do this and be around this stuff. And it was at the very end, we had our first case, and this gal was 76, 78 years old, fuzzy memory now at this point, but took no medications, went to lunch in her assisted living, had a fever and was sent to the ER. And she was the first case positive. And then I went off service, and she, like I said, otherwise healthy, no medications, and she was dead Friday morning.
Wow.
I mean, it's at that point was a real wake-up call to what we were dealing with. As you moved into Delta and Omicron, the severity has come down, and the morbidity and mortality have improved, but that still doesn't mean they don't come with concerns,
right,
or that we're going to stay in this version. I'm sure you saw the fund that a university in Boston and Florida were working on Omicron components along with the original version, and had like an 80% kill rate in mice. So there's nothing to say that we're not out of the woods with this. I sure hope we are. We did almost 35,000 COVID tests last year, and if I never do another COVID test as an organization, I'll be thrilled.
Right.
But it's something that now we're kind of in this lull, and it's easy to sit back and say, well, we don't need this because it's now not a whole lot different than a cold. I had a patient who had a cold. We couldn't get any other test to be positive. And he's like, I wish I had COVID again because this is worse. And I think we've all kind of forgotten. You see a lot of people who get a cold and they're really miserable, and they're like, what's going on? I don't remember it being this bad. And I think for 2 years, whether it was the distancing, the masking, like people kind of forgot just how miserable viruses are in general.
Right.
And now we have a population who's getting all of these things. I think there were 9 or 10 circulating in the month of September into October.
Oh my word. So it's kind of like, it was kind of like a powder keg, or like trying to, I don't know what the best metaphor here is, but it was kind of like we were holding back this stuff and then we released it all at the same time, and it's just working its way through the population.
Yep. All of them are having their reunion tour, or whatever you could think of as a concert tour for like Motley Crue or some old washed up 80 bands that I've listened to.
It's Woodstock for viruses is what you're telling me.
Yes.
Yeah.
And I think and you know, whether you liked or didn't like all of the parts that went with the initial component, the masking, the distancing, et cetera. I mean, I have never had so few cases of influenza diagnosed. And, you know, a lot of people say, well, you weren't testing for it. Everyone was so focused on COVID. Everyone got a COVID swab and an influenza swab, and the number of influenza cases was drastically lower. And again, this was probably masking and distancing. And those things are gone, and we haven't seen an uptick really in influenza yet, but in parainfluenza and a bunch of other respiratory viruses. I joke that you look at our urgent care schedule, and there will be 20 people in a row with cold symptoms of some sort that are showing up, and it's definitely different than it was. I mean, at least we could say, oh, everyone here has COVID because they're all coming in at the same time, same set of symptoms. This is back to viral potpourri.
Yeah. So earlier you did mention like making recommendations that the CDC health leaders weren't entirely sure about. A couple of the famous flubs, obviously, were vaccines prevent transmission, which we figured out later they didn't. And then also there was the recommendation to wear like the equivalent of like t-shirt fabric on your face and saying that would do anything. And like, you know, these are from health professionals that I understand the vaccine. They first roll that out. They think it's going to prevent transmission because they saw something in a lab and it didn't work out that way. But the t-shirt fabric on the face and recommending fabric masks, like, I mean, they should have known better. They did, you know, testing for gas and viruses in like the 50s and 60s. Then they knew better, right? Perfect seal. So like because of these missteps, Has this changed like your patients' trust in the healthcare system and the CDC, or for better or for worse?
Some absolutely. It's caused some distrust. I don't think in the medical community, I don't think their mistrust is with their individual providers and the care they receive. I think again, looking at the initial component, we made some suboptimal decisions would be the best way to put the cloth masks. At the same time, you could spend $100 to go buy a roll of toilet paper because people were making some irrational decisions. And at that point, the ability to get those masks into healthcare settings and keep them there versus having them disappearing throughout society was part of that decision. Now, it lasted, in my opinion, way too long on the cloth masks.
Yeah.
And, whether it's because we were doing COVID care all the time, and I always had medical grade surgical masks available and N95s. I mean, I never got onto the cloth mask component, but I understand how if you weren't readily available to get that it seemed to and everyone had like an aunt or some relative who was out like making masks in massive quantities and doling them out with kitties on them and things like that. I think you had people who they were trying to contribute and help as they could. And, was it a misstep to let people go that direction? Probably, but
I wonder if we're going to see data later that maybe the masks provided a false sense of security. So people went out and got closer because they had a mask on. They thought everything was okay. That's me guessing, right? Like I haven't read data on that. I just kind of, my gut says, I wonder if the not being clear on the masks actually harmed us. I don't know if that's true. Really quick, we're at the last couple seconds, but really quick, over in general, from your patients, are you seeing, just like you mentioned earlier, there was political talking points, there was disagreement, this has been quite a firestorm. Have you seen more vaccine hesitancy across the board or less?
So that's a great question. And are you okay if I touch on some of the political component? Not to be, it's not inflammatory, but
no, that's totally fine. I don't mind that at all, but I'm just curious because anytime you introduce politics into a health discussion, I just am curious if your patients are trying to, if basically they're refusing vaccines now or they're more accepting of vaccines. Cause I have seen a little bit of research that patients are resisting boosters now, but I don't know if that applies to all vaccines in general.
I would not generalize it out, I think, and it's interesting because I actually was less enthusiastic about the previous booster that was available. So when they'd had their initial booster and then it was kind of the spring-summer booster time frame again, I was actually very laxed in pushing people to get that, knowing that the ones that were more effective against Omicron and some of the original strains was coming out this fall. So I actually delayed some people doing that. But generally, I can think of, out of my practice, one, maybe two people who, after we sat down and had a face-to-face discussion, have chosen to avoid getting vaccinated. And I had some people who came in and they looked at me and they said, the last thing I'm going to do is let you jab me. And we'd sit and have a discussion of why I thought it. And again, that's where I think that personal relationship with a provider is really important. I had some people who were really adamantly opposed to it, who, when we talked through kind of my worldview of it, were much more accepting. So I think there are definitely people who are really leery, but they were probably going to be leery and less inclined to do this anyways, and this has amplified that. But the vast majority of people who are trying to take care of themselves and do what's best in their self-interest, which is kind of human nature, most people are still willing to at least have the conversation and consider these things.
Yeah, so it sounds like, and again, correct me if I'm wrong, but overall, then, just to recap the entire discussion, we're not sure what the CDC is going to do. We're not sure what local cities, municipalities, and schools are going to do. But the bottom line here is, you believe, and correct me if I'm wrong, like I said, but you believe that vaccines probably shouldn't be mandated, but this should definitely be a discussion that you have with your physician and you talk through the options.
Absolutely. All healthcare is individualized and personalized, and as many good and bad decisions as have been made through all of this, the having someone you trust to have the conversation who should have your best interest at hand,
right,
is still the best path forward.
Dr.
I know
Jon,
that's kind of a generic, bland answer, but it's still the right one.
No, it's not. It's not a generic, bland answer. It's a good one, and I appreciate you making it. Dr. Jon Van Der Veer, founder of Exemplar Care, I really appreciate you coming on the show today. If people want to reach out to you, visit your, I don't know if you call it a facility, medical practice, how do they do that?
So first off, it would be visit www.exemplar.care, not .com. That would allow for access to our 24/7 urgent care. That is for members and non-members alike. And if folks are interested in our membership model of primary care, information is available there as well.
I appreciate that. And thank you so much for coming on the Iowa podcast.
Absolutely. Thank you very much for the opportunity.
And to my fellow Iowans, Iowa expats, and Iowans at heart, thanks for listening and subscribing to the Iowa Podcast.